Welcome to Avalon Wellness and Performance. I hope you're all doing great. My name is Maxine. I am a osteopathic manual practitioner, licensed massage practitioner, and also a craniosacral therapist, active release technique therapist. I hope you're all doing great. Today I want to take a few minutes to talk about Diastasis Recti. Super common. We see it often postpartum. And I just want to explain a few do's and don'ts. I've been seeing this through my entire practice, and it's something that women deal with postpartum. We're talking we can be years after having children, and you can still have some of the effects of diastasis recti. So what is diastasis recti? Number one, it is a separation of your fascia, your connective tissue between your rectus abdominis, which is basically your four-pack muscles. So it's muscles that attach here. They attach from your pubis bones all the way up to the xiphoid up here. And the linea alba is a thickening there. And sometimes it's quite normal. During pregnancy, it'll separate. And you can test that by putting your finger right above your belly button here. And if you crunch and you sink in, gives you an idea of how much space you have. It can be quite wide sometimes, depending on how your pregnancy was. This is totally normal, and it is oftentimes manageable and something that you can work on with help or on your own to get full function of your abdominal and your core again. So I want to go over that. There's a few myths and misconceptions. One is that you need surgery. You do not have to have surgery. That should be like a last resort. It still is helpful. It can be a solution, but there's a lot of things that can be done before surgery. Another thing is don't just do crunches. Okay. What happens is you can get doming in that space, and it's a weakness, and crunches is a high impact on that zone. It's not really going to help. It's also not super functional. In life, you're not doing crunches to pick up bags, but you still need a hard core, a strong core to pick up your grocery bags or pick up your kid. So, when you're doing movement, you want to try and make sure it makes sense to translating it into normal functional life activities. So what your do's are: you want to work on breath. Breath is extremely important. We see a lot of incontinence too postpartum, and that's oftentimes related to your breath being out of sync. So when your diaphragm descends, your pelvic floor should descend too. And when you're breathing, we need to have the whole torso expand and come back in naturally. So doing some 90-90 breathing can be really beneficial. It's really going to help you connect with this area of your body, with your pelvis too. You should have a gentle tilt as you're breathing, and if you can engage that tilt naturally when you're doing your movements to rehab, you'll have a much better effect. So definitely you want to work on your breath work. We have a number of great tutorials on that, so you can look at that on our page. Another exercise that I really recommend is the dead bug, and I like the wall dead bug because it's supported, so it's closed chain. So and what happens is you're not actually creating any movement here, but you're engaging the muscles here, and that's how the core is really meant to work. We're a lot less likely to get injured in our limbs when we have a strong core, because it's creating stability so your shoulder and your hip can move freely with security and everything in the right places. The other thing is don't wait, go see a pelvic floor physical therapist or a nurse that's specialized in pelvic floor physical therapy. We have people that follow us a little everywhere. In Canada, we have physiotherapists, and in Australia too. Get help from a professional, and it doesn't matter how far postpartum you are. You might have some scar tissue that you might need guidance to break it up, especially if you've had a cesarean. It can be years later, and you can still get a lot of relief with a little guidance. So those are things that we highly recommend. The don'ts. The don'ts are your high pressure exercises. So if you're getting doming or coning, so there's like an extension that happens here between the two muscles, that's a sign that you probably have diastasis recti. Planks, high pressure, it's not going to help you. It might actually cause it to go a little more apart. The other thing, you might want to avoid crunches or leg lifts. And most importantly, the worst thing you can do is ignore the symptom. So your best bet is to be proactive, ask questions, come in here. We're here to help. We love to help you guys with this stuff. And, and you can work with PT, work with your doctor. You'll get lots of results there. I'm going to tag in the comments. I just published a blog on this with links to a few exercises. We have a bunch of tutorials on our website. I've worked with a lot of women postpartum, and when I'm saying postpartum, I'm talking some women that had given birth 20 years earlier, and I helped them resolve some of these issues. So if you're located in Naples, Florida, we'd love to work with you. But if you're not in Naples, Florida, there's people all over the world that can help you, and you can also do a lot of the work at home. So focus on really great breath work and some, smart core activation is really going to help. And then you can do a little bit of self-massage. So if you've had a cesarean, gently massaging along the incision really helps reduce the scar tissue, and you probably have some trigger points in there that you'll be able to release and then capture better engagement of your abdominal muscles. And that's it. So if you have any questions, please leave them in here. I'll follow up later. I like to do one blog post and a YouTube a week, so I can come back to this again. And if you have any questions, I'll be here. Thank you so much, and I wish you all the best. Have a great day. Bye.